My dear, please read your task. Okay, about the VIN. Please let me know when you are ready.
Mhm. Okay, ma'am. Hello, I'm Dr. Insha, one of the doctors in the clinic today. May I confirm your name and age?
Yes, this is Mary Rose, and I am 65.
Okay. So can I call you Mary?
Okay.
Well, Mary, what brings you to the clinic today?
What bring me? I'm here to discuss a report.
Okay.
Um,
So,
I have been here, and you were not my doctor. I have seen another doctor last time.
okay. Okay.
So I
So,
I would like
mhm.
to know what's in the report, please.
Okay. Is it okay if I ask you a few questions to know about your symptoms?
It's
Or
fine.
would you? Okay.
But did you
So,
have do you have do you have my report with you?
okay, okay. Okay. I have confirmed your name and NHS number, and the report belongs to you. But the report is of some concern. So, do you want somebody to accompany you while I disclose the report?
No, I'm a big
Or you
girl.
want me?
I'm a big girl.
Okay,
I'm fine.
okay, okay. Good, good. So, Mary, what your report is showing that uh, the biopsy that we took from down below. The report is showing that you are suffering from VIN, which is vaginal interepithelial neoplasia 3. Okay, so that is where the cells of your vulva have undergone a certain change. Okay, and they are basically abnormal. So in this, what we are afraid of mostly is that there is a change. There could be a change of them turning into malignancy. Okay, so there
So
is a
that a cancer? I don't understand really. Is that a cancer?
yeah. No, it's not a cancer, but these kind of changes, they do have a high risk of turning into cancer, basically,
Oh,
if they
oh.
are not treated at the appropriate time.
Can
Okay.
you treat can you treat it?
Yeah, of course we can treat it. We will have to basically, after we have a certain your health and fitness, we will have to we'll have to have a small operation called, it's a local excision. Okay, like
Yeah.
we locally remove the area that is diseased. Okay, but before that, I do need to ask you a couple of questions, so as to understand whether you're fit and healthy
Yes, I am. I am. Yeah.
otherwise. Okay,
Yeah.
so this problem, how long has it been affecting you?
Oh, this is like last year. The whole year was nightmare.
Okay, and what all have you done to treat it?
Creams, ointment, creams,
Mm-hmm.
ointment, everything I have tried. I have tried some treatment from the over the counter. I have tried some treatment from my GP, but nothing worked.
Okay. Any other problems that you're experiencing, like with regards to, do you have any pain during, passage of urine or in opening your bowels?
Sometimes with the urine, the whole area is sore and the whole area. is,
Okay.
very, very tender. Okay. So sometimes, yes, it's very difficult when I go to pee
Okay.
because
And it's causing you problems in sexual intercourse as well?
oh dear, yes, it is. I can't tell you.
Okay. And how is your appetite? Any history of weight
I'm
loss?
fine. No, no, nothing.
Okay. Uh, and have you been on hormonal replacement therapy?
This is, I stopped after my period stopped when I was 51, and then I got like 3 years of treatment, but then I stopped it.
Okay. Any medical conditions that you're seeking your GP for,
No,
or any surgeries in the past?
no,
Any allergies?
no, I don't have allergy.
Okay. Fine. And this is how's your mental health in general, and how's this affecting you?
I'm not sleeping well, and I'm very anxious because also
Okay.
my relation with my partner, I don't want him to touch me because of this. And I feel also, I feel like I'm a bit, you know, chained because, the area eh, doesn't
Mm-hmm.
look very pretty.
And that's quite understandable. If you'd like, I'd connect you to a counselor, and you can talk to him, and he can elevate
You
your
said you
anxiety
said you can
regarding
treat
this.
me, so just a treatment, it will be fine.
Yes, yes, yes. So, talking about the treatment, basically, I'd like to order in some baseline investigations like your blood test, test for your liver function, test for your kidney function. Okay, and
Why
do an
I'm good?
investigation. Yeah.
Why you will do test for me? I'm fine.
Yes, yes. So that is because we are going to have to, put you under anesthesia, okay, for the excision. So we need to
So
be certain that,
that's mean you will do a surgery for me.
yes, 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 we'll do a
And
surgery for you.
but this is a very private area. How are you going to do a surgery there and there will be a scar?
Yeah, basically, we'd like to only remove the area which is diseased, okay? So it's a local excision, all right? So the diseased area, and we like to have
Will
a
you remove it
disease-free
all?
zone.
Will
No,
you
no,
remove
no, we will not remove. No, 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 we will not remove the entire,
can you show to me?
the area.
Can can you
Yes,
show me?
just
Can you show me
yes,
what is the part that you're going to remove?
yes.
Pretend.
Okay, okay, okay. So, like, if this is the lesion, so we are
Yeah.
going to go a little bit around it, okay, and then leave a little bit of margin. So this will be
Okay.
around 2 centimeters. So we'll go 2 centimeter around. So as you can see, this is quite a small area, and it can be repaired very well. Okay.
For
And
me,
you'll
it's
just have
very
a
big,
small
and for me,
scar.
I think that it wouldn't look nice. I don't
Yes.
think it would be nice.
Of course, your concerns are valid. We'll have, specialist, a team of doctors with us, our specialist consultant. We'll also have somebody who deals with skin surgeries. That is called a plastic surgeon with us. Okay, as well
Oh,
as yes, 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 we'll have also bladder doctor with us in case the area it approaches near your urethra, that is uh, 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 near your urethra, so we'll have that with us. So I don't think you need to worry about those things. Okay,
okay. Okay, so
but
it
it
will
would
leave.
leave a scar.
Oh, so is there is another option? Can I have some tablets and or some ointment and that's it?
No, unfortunately, because it is grade 3, so ointments and tablets are not, recommended for it. So oxygen is the only way to go about it. Okay.
Okay.
Okay. So, do you have any other questions for me?
Yeah, I'm so sad now. I don't want really to have this surgery. I'm afraid, and I don't know what shall I do. What do you think, doctor? You are the doctor here. Please tell me, what shall I do?
I think uh, you should, consider having the surgery. Okay,
Okay.
but we have other options like we can go for laser treatment of it as well. Okay, if
Oh,
you're
okay. That sounds good now. Okay. Is it is it safe to have the
yes,
laser on?
it is safe, but every surgery has its complications, so you run the risk of getting some burns down there. Okay, some burns, some pain later on.
Okay. Okay. So it will be very difficult. Yeah. Okay. Okay.
Okay, so I would also connect you to our multidisciplinary team of doctors. Okay, and you can discuss your further concerns with them. Okay,
Okay. Okay. Thank you.
okay, thank
Are
you.
you sure that there is no other cream?
uh, it's, I think, eMRCOG you can give. I'm not sure, ma'am. Basically, I haven't revised this topic. I haven't started oncology
No
yet.
problem. No problem. No, no problem at all. No
That's why I
problem
was
at
a
all.
bit confused.
You did really well. Okay, really with the patient, and she was acting like a very demanding patient, interrupting you so much. Okay, which is,
Basically, I
by
was,
the way,
yeah.
yeah, it's known in the exam, this task is known in the exam. I remember one of my, candidates who attended an online exam, and she said, and another one also was in the face-to-face exam. And the candidate who attended the online exam, she said she keep on, uh, getting too close to the camera, and I was scared. I was thinking like, oh my God, why she's acting like that? And I was a bit freezed. Okay, she was afraid from the patient because the patient was talking too much and the patient was interrupting her. Okay, and for everything you know, um, like undermining the doctor decision. Sometimes she say, "Oh, will you treat me? You can treat me. Are you sure?" Something like that. Okay,
Mhm.
but it was fine. It was fine. You did well. Okay,
I couldn't
and
remember basically because I haven't started oncology yet. So,
good,
but still,
good
ma'am,
drawing as well. Good drawing as well.
thank you
Okay,
so much.
you are
Ma'am,
welcome.
please tell me how I should improve on it and what all
Yes,
things.
I think that you have a good technique, basically. Okay, I well done for that. Because you have, been able to be very flexible with the patient, and at the same time, you have managed to grab, each part of the consultation nicely. Okay, and for the breaking bad news or for the concerning news, I would say, okay, it was fine. In the part of the information gathering, you didn't allow the patient to take you, into many side talks and questions. You were focused. So you have managed exactly, okay, to go through the information gathering in the right time. Okay, it was focused and concise, which is fine. Okay, in your explanation, okay, um, yeah, I will advise you to go for more lay terms in the explanation, okay?
Mhm.
So for the explanation, you can also use the drawing if you are in the face-to-face exam. It will always
Okay.
help, okay? So vulval interstitial neoplasia, this is a big name, so mostly patient will not understand what it is. So this is describe the changes that occur in the skin of the vulva or the private part, outer part of your private parts. So abnormal cells develop in the surface layer of the skin, and it's not a cancer. Okay, so we have to make it like highlighted, because they always ask, is it a cancer? Is it a cancer? No, it's not a cancer. So to start with, even some women, it might disappear without treatment, right? In other women, if the changes are more severe, there's a chance that the cancer can develop, and this is why we call it a precancerous condition. Okay, so
Okay.
regarding the treatment options of the VIN, okay, so the VIN, of course, it's divided into um, grades or types. Okay, so types of the VIN. Firstly, we have the usual or the classical type, okay, which include the low grade and the high grade squamous intraepithelial lesion. And we have the also differentiated type. So the
Mm-hmm.
usual one or the classical one, this is the most common VIN, right? Which can be either low grade or high grade, right? And also we can hear terms like VIN 1, 2, 3, okay? And this is the doctors how they classify, okay, the VIN. So when you explain to her, it will be good to explain to her by drawing, okay, that this is a normal skin and this is the changes, the level of the changes, and you are here, okay, and show her the VIN, okay, 3. And then after that will become the cancer. So she will see like this, okay? So if we have, this is a normal skin, okay? And then afterwards, I'll choose another, and this is the cancer, okay? And in the way in between, there are different levels, okay, of the changes, of the cell changes. So here, when the cell changes like this, we call it VIN1. When it is like this, we call it VIN2. Okay? When it is like this, we call it the VIN3. Okay? So just to show her about the different levels, and she is exactly here. Okay? Right before cancer. Right? So
Okay.
here comes the importance of counseling for the types of the treatment. Right?
Mm.
By the way, before we go to the treatment, the other type, which is the differentiated, okay, which is linked to the HPV infection, okay, this is the less common type and the less common in this age, but we always ask the patient about her smears, of course, okay, especially that
Mm.
one of the recall cases came that she had previous lids, okay,
Okay.
and another one came at the background of lichen sclerosis. So you have to ascertain, okay, what if she had any abnormal smears before. Okay,
Okay.
so regarding the treatment option, okay, the treatment option, of course, that will depend. You have to start like this with her. That will depend on the where the VIN is, your symptoms, okay, and the also the degree or the grade, okay, and options are one of the three. So either surgery or treatment with a cream called the eMRCOG cream, or the laser treatment. Those are the major three things that we go for it. Okay? And the important thing when you come to the discussion of the types of the treatment, you have to ask her if she's interested in particular type, so you can at least start with it and secure your, your mark and time as well. So ask her
Okay.
if she had any preferences or if she have ever heard about it. Okay, if she said particularly that I don't know, please let me know about them, that's mean you have to cover the three equally. But if she's interested with some particular type, start with this type and then take her permission to speak about the other options. Okay, so our patient here, okay, she was one of the types, okay, or one of the patient that refused the surgery. He doesn't want the surgery in this area. So here
Mm-hmm.
it comes you to explain the eMRCOG cream, okay, and you have to explain everything about it, what it is, how it does it work, what is the benefit, what is the side effect, okay? So this is what we need to cover in any treatment. I start with eMRCOG and then I give her a hint about the other two options and ask her, would you like me to speak more about the other options? okay?
Mhm.
At least mention them, okay? If she said yes, it's fine, that means it's on your marking sheet. If she said no, okay, then rarely she will say no, to be honest, okay? Then that's mean it's not required in details, just highlight, okay? For the eMRCOG cream, this cream is working by stimulating your own immune system, okay? To kill or to erase the types of the abnormal cells, okay? It's more
Okay.
effective, to be honest, with the types that is associated with the HPV, with the virus, okay? But since she want to know about it, and you know that the correct action for her is the surgery, okay? Then at least give her,
Mhm.
answer her question, okay? So usually start applying to the cream to the affected area once per week, and you may slowly increase it to 3 times per week, and it might take few months, up to 4 months, till you get the result, till it work. Okay, it
Okay.
can cause some side effects, and the most common side effect is um, burning sensation or inflammation around the vulval skin. Okay,
Mhm.
so this might cause the skin to become red, sore, and itchy. Might have some peeling of the skin or cracks or whipping. Once you say that to the patient, okay, she will be more scared because actually she is complaining of the burning so much since the beginning, right?
Yes, ma'am.
Right. So here you come to the other options. Laser treatment for the VIN can cause hair loss around the vulva, right? And it changes in the skin of color around it as well. But when it comes to surgery, the good thing about surgery is to remove the all skin affected, okay? And also with we call it a safety margin or a normal tissue surrounded to ensure that every abnormal cells is removed. Then we send it to the lab for another confirmation, okay, that is cleared from the body. Um, so you have informed her about the options of the plastic surgery afterwards, and explained to her that this is only a local or partial or part of the vulva that is being removed. So you have covered the surgery really well, okay? But
Mhm.
you're required to cover the eMRCOG and laser as well for the patient. Whether the
Okay.
patient asked you for certain or particular treatment or not, you have to cover the three. Okay, my dear?
Okay, ma'am. Mm.
So another thing that your patient looks in a stressful condition, okay, and she speak about that she is suffering, okay, so it's yes, coping. Tell her that I know that coping with the chronic itching and this condition is difficult, okay, and I know that you might feel uncomfortable or even embarrassed. Okay, so you can benefit from talking to somebody. Okay, I may also connect you to a counselor or to a group. Okay, of people who have been through the same experience as yours. If you think that will help. Would that be okay? Take her permission for everything, okay? If she said yes, that means she agree for the referral and all. Okay, you
Mhm.
can, the counselor, you can explain it that this is a trained health professional, okay, like the practice nurse or the specialist nurse. Another important safety point about the VIN treatment will not be with the GP. VIN treatment will be with the vulval clinic, okay? And the patient will need a follow-up after the surgery. You have to mention the follow-up even if you don't remember the frequency of the follow-up, my dear.
Okay.
Okay, so you have to mention the importance of the follow-up. It will be considered as a safety point. Why? Because there is a risk of recurrence. Okay, this is a very important point. Okay, another point of all the types of VIN, okay, that whenever we have a VIN case, we have to also arrange from part of the investigation is the colposcopy. So you asked her, or you mentioned to her about the blood test, okay, for the part of
Mhm.
the investigation. told her about the blood test. Actually, the most important thing, okay, is to have examination by the magnified lens, by the colposcope. Okay, dear?
Mm. Okay,
So
ma'am.
the patient, please don't forget safety for any condition with risk of recurrence, okay? That you make her aware of the risk of recurrence. It would be very good if you have time to warn her about red flag signs. Okay, it will be very good as well from you. That means that you will have, full mark of this task. So follow up and the recurrence is very important. Okay. Otherwise, the patient will think that, okay, now I'm being treated. I'm finished. No, she should know that unfortunately she had to stay with us a little bit more. Okay, dear, I recommend you also to have a look to the vulval interepithelial neoplasia TUG article, which is one of the recent TUG article. It might come as a structured discussion
Okay,
task.
ma'am.
Okay, so please have a review of this TUG article. And Dr. Nada, our mentor, okay, in the eMRCOG, she had a lovely summary for this TUG article, so I can forward the recording and the file to you guys on the group so you can read it and get to know.
Yes, ma'am. That would be of much help. Thank
Okay,
you so much, ma'am.
Dr. Rabaa?
yes, dear.
Yeah, so in the I just want to ask, there is a question, and I think in the Oxford, the lady was young. She's 37, I think. She had previous slats for the sinatry, and she had renal transplant, and now she was having bulbal itching, and she diagnosed with a VIN3. So according to the new talk articles, like if a patient is young and if it is HPV related, so first line treatment is eMRCOG. So we should say this like this.
I'll tell you, my dear. Okay? Again, again, we have to counsel about the all option. Okay?
Mm-hmm.
And then we say the preference of one over the other. Okay?
Okay.
So we have to take care also that some patient might also, okay, have like they are afraid of the recurrence. She's having some immunosuppressant. She might have also, risk factor for the recurrence or the spread. So it may be better for her to have a surgery. So it's according to the patient. Our rule in the Part3 is we counsel, right?
Mm-hmm.
I will give her the three informations, okay? But I will only add the small point that there is evidence, okay? Or there is recent evidence about the cream, okay? That
Mm-hmm.
it might be uh, highly recommended in your case.
Mm-hmm.
That's it, okay?
Okay.
And don't forget, guys, I don't remember really if I mentioned this or not. Don't forget the rule of the MDT in all cancer cases, okay? Even if this is require a local treatment, okay? This will be a local MDT in the hospital, okay? Why? Because the case will have any precancerous lesion will have to be seen by the seniors, okay? To ensure that there is no hidden cancer. Okay?
Okay.
Okay. Thank you very much, my friends, and be ready for the next.
Yes. Yes, ma'am.